Kia ora everyone, Dr. Amelia Fraser here. I've been a urologist right here in New Zealand for over 15 years now, and today I'm going to share something with you that most blokes don't know about, but absolutely should. If you're over 50 and you've noticed that things down below aren't quite responding the way they used to, especially first thing in the morning, then you need to hear this. I'm talking about that natural morning vitality that you might have taken for granted in your younger years. You know what I mean? Waking up ready to go, feeling that surge of energy and life. But now, maybe not so much. And mate, I'm here to tell you that this isn't just about getting older. There's actually something you can do about it, and it starts tonight. Now, before we dive in, I want you to understand something really important. What I'm about to share with you isn't just about your intimate life, though that's certainly part of it. This is about your overall health, your confidence, and honestly, your quality of life as you get older. And here's the thing. I've seen hundreds of blokes in my clinic over the years, good Kiwi men who thought they just had to accept the decline, who reckoned it was all part and parcel of aging, but they were wrong, and I'm going to show you why. So let me ask you this. Have you noticed that your body doesn't respond quite the same way after 50? Do you wake up without that natural vitality you once had? Does it feel like your energy and desire are slowly fading night after night? Yeah, I thought so. You're not alone, mate. This is incredibly common, and the good news is that there's a scientific explanation for what's happening. And more importantly, there are things you can do about it. Here's something that might surprise you. Did you know that one of the most important regeneration processes in your body happens while you're asleep? I'm talking about deep sleep, particularly the REM phase. This is when your body goes into repair mode, and it's actually responsible for something called spontaneous erections during the night. Now, I know that might sound a bit clinical, but stick with me here because this is crucial. These nighttime erections aren't just random. They're your body's way of maintaining healthy tissue and blood flow. It's like your body's doing maintenance work while you're unconscious. Pretty clever, right? But here's where it gets interesting. As we age, especially after 40 or 50, several things start to happen. The blood flow decreases, the erectile tissue loses some of its elasticity, and your risk for developing various health issues increases. And when you're not getting those regular nighttime erections, which, by the way, you should be getting 3 to 5 times each night during healthy sleep, that tissue doesn't get the oxygen and nutrients it needs. It's a bit like owning a bish down in Queenstown that you never use. If you don't maintain it, it deteriorates. Same principle applies here, guys. Now, I want to talk about something that's probably sitting on your bedside table right now. Or maybe you're even watching this on it. Your phone. That smartphone, tablet, or even your telly. They're all emitting something called blue light. And this blue light is directly sabotaging your sexual function. I'm not making this up, mate. This is backed by solid research. According to a study from Johns Hopkins University, and these are top researchers, not just some random bloggers on the internet. Men who use screens in the hour before bed have testosterone levels that are 23% lower than men who practice good sleep hygiene. 23%. That's nearly a quarter of your testosterone just gone because you are scrolling through Facebook or watching Netflix before bed. Why does this happen? Well, blue light tricks your brain into thinking it's still daytime. Your body's supposed to be winding down, getting ready for that deep, restorative sleep I mentioned earlier. But instead, your brain's getting signals that say, Stay awake. It's still light out. This disrupts your circadian rhythm, which then affects your melatonin production, which then affects your testosterone, which then affects everything else. It's all connected, you see. Your body's an incredibly complex system, and when you mess with one part of it, there are flow-on effects everywhere else. So what can you do about it? Here's technique number 1, and it's dead simple. At least 1 hour before bed, preferably 2 if you can manage it, put the screens away. All of them. Phone goes on the charger in another room, telly gets turned off, tablet gets closed. I know, you're thinking, but Amelia, I need my phone for my alarm. Get yourself a proper alarm clock, mate. They still make them, and they're cheap as chips. This one change alone can make a massive difference. But let me give you something even more powerful. This is a technique I recommend to nearly all my patients, and it's called the 4-7-8 breathing method. Now, I didn't invent this. It's been around for ages, and it's based on ancient breathing practices. But I can tell you from 15 years of clinical experience that it works an absolute treat. Here's how you do it. Breathe in through your nose for 4 seconds. Hold that breath for 7 seconds. Then breathe out through your mouth for 8 seconds. That's it. Simple as. Do this 6 times when you're lying in bed, ready to sleep. What this does is activate your parasympathetic nervous system. That's the part of your nervous system responsible for relaxation, for improving blood flow, and for activating your body's repair mechanisms. When you slow down your breathing like this, you're essentially telling your body, right, it's safe now, time to rest and repair. Your heart rate slows, your blood pressure drops, and your body shifts into that restorative state where all the good stuff happens, including those important nighttime erections we talked about. Now, I want to address something that came up in the comments on the original video, because I think it's really important. One of you blokes asked, what about us older guys? I'm 85. Does any of this still work? And mate, I'm so glad you asked that, because the answer is absolutely yes. Listen, your body doesn't just give up at 80 or 85 or even 90. It might not work exactly the same way it did at 30, fair enough, but the principles still apply. Good sleep hygiene, proper breathing techniques, managing your screen time. These things benefit you at any age. The key is being realistic about your expectations and understanding that maintenance and quality of life are just as important as peak performance. And here's something else I want to touch on, because another viewer asked about it. What about us blokes who don't have a partner? This is a really valid question, and honestly, it's something I see a lot in my practice. The thing is, mate, these techniques aren't just about partnered intimacy. They're about your overall health and well-being. The nighttime repair process I mentioned, it happens whether you're with someone or not. Your testosterone levels, your blood flow, your tissue health. All of that matters, regardless of your relationship status. Plus, and this is important, maintaining your sexual health actually improves your cardiovascular health, your mood, your energy levels, and even your cognitive function. So even if you're flying solo right now, you're still investing in your overall health by following these practices. Right, let's talk about another massive factor that most people don't realise affects their intimate health, and that's what and when you eat in the evening. I've had countless patients come to me with issues, and when we dig into their daily routines, we discover they're having massive feeds late at night. We're talking full roast dinners at 9 p.m, mate. And here's the problem with that. When you eat a heavy meal close to bedtime, your body has to divert heaps of blood flow to your digestive system to process all that food. That's blood flow that should be available for other functions during sleep, including those nighttime erections that are so important for tissue health. There's also the issue of insulin and blood sugar. When you eat a big meal, especially one high in refined carbs or sugars, your blood sugar spikes, your insulin spikes, and this can actually suppress testosterone production. Not ideal, right? So here's what I recommend. Try to finish eating at least 3 hours before bed. If you absolutely must have something, keep it light. Maybe a bit of fruit or a handful of nuts. Nothing too heavy. Your body will thank you for it, and you'll probably sleep better too. Now, let's talk about something that might seem unrelated but actually isn't, and that's stress management.
I know everyone bangs on about stress these days, but hear me out, because this is directly relevant to what we're discussing. When you're stressed, your body produces cortisol. Cortisol is your stress hormone, and it's actually antagonistic to testosterone. What that means is that when cortisol is high, testosterone tends to be low. In chronic stress, the kind that comes from work worries, financial pressure, relationship issues, or even just the general anxiety of getting older, keeps your cortisol elevated all the time. This is where that breathing technique I mentioned earlier becomes even more valuable. It's not just about preparing for sleep, it's also a powerful stress management tool. You can do it during the day whenever you feel stressed or anxious. 4 seconds in, 7 seconds hold, 8 seconds out. Do it 6 times and I guarantee you'll feel calmer. And over time, this kind of regular stress management practice can actually help restore hormonal balance in your body. Here's another practical tip that I've found really helps my patients. Create what I call a wind down routine. We Kiwis are pretty good at routines. Think about your morning coffee ritual or your Saturday Arvo routine. Apply that same thinking to your evenings. About 90 minutes before bed, start dimming the lights in your house. If you've got smart lights or dimmers, use them. Your brain responds to light cues, remember? Then maybe have a warm shower. Nothing too hot, mind you, because your body temperature needs to drop slightly for good sleep. After your shower, that's when you do your breathing exercises. Then into bed, no screens, maybe read a book or listen to some quiet music. Make this your routine, stick to it, and your body will start anticipating sleep.
Now, I want to talk about something that's often overlooked but is absolutely crucial, and that's the role of exercise. Not just any exercise, mind you, but the right kind of exercise. You don't need to be training like an All Black, but you do need to be moving your body regularly. Cardiovascular exercise, things like walking, cycling, swimming, improves blood flow throughout your entire body, including to those areas we're particularly concerned about. Aim for at least 30 minutes most days of the week. And here's a bonus. Exercise also helps with sleep quality, reduces stress, and naturally boosts testosterone levels. It's a win-win-win situation. But here's something specific I want you to try. Pelvic floor exercises. Now, you might think these are just for women, especially after childbirth, but that's absolutely not true. Men have pelvic floor muscles too, and they're directly involved in erectile function. These muscles control blood flow and help maintain erections. The good news is they're pretty easy to exercise. You know that feeling when you're trying to stop yourself from urinating midstream? Those are your pelvic floor muscles. Contract them. Hold for 5 seconds. Release. Do this 10 times, 3 times a day. You can do it anywhere. Sitting at your desk, watching telly, waiting in traffic. No one will know, and over a few weeks you'll notice a real difference. Let me address something else that came up in the comments. Someone asked if these techniques work for women too, and the answer is yes, absolutely. While this particular video is focused on male sexual health, the principles of good sleep hygiene, stress management, and pelvic floor exercises are just as relevant for women. If you're in a relationship, getting your partner on board with some of these practices, particularly the screen-free evening routine and the breathing exercises, can actually be a really nice bonding experience. You're both investing in better health together. Speaking of partners, let's talk about communication for a moment. This is something I see causing problems all the time in my practice. Blokes come in with concerns about their sexual function, but they haven't actually talked to their partners about it. They're suffering in silence, feeling embarrassed or ashamed, and meanwhile, their partner might be thinking they're not interested anymore, or that there's some other problem in the relationship. Listen, I get it. These conversations can be awkward. We Kiwis aren't always the best at talking about this stuff. But I'm telling you, mate, opening up about what you're experiencing and what you're doing to address it can actually bring you closer together. Your partner will likely be supportive and might even want to help. Don't shoulder this burden alone. Now, I want to give you a realistic timeline for what to expect when you start implementing these changes. This isn't a magic pill situation. You're not going to do the breathing exercises once and wake up like you're 25 again. These are lifestyle changes, and they take time to work. Generally, I tell my patients to give it a solid month of consistent practice before expecting to see significant results. Some things you might notice sooner. Better sleep quality, feeling more relaxed, having more energy during the day. But the full benefits, particularly regarding sexual function, typically take 4 to 6 weeks of consistent practice to really manifest. And here's the thing. Consistency is key. You can't do this for a week, not see dramatic results, and then give up. Your body needs time to adjust and respond. Think of it like training for a marathon. You don't run one day and expect to be ready. You build up gradually, consistently, and the results come with time. Same principle here. Let me also talk about something that I think is really important, but often gets ignored, and that's the mental side of all this. A lot of the challenges men face with sexual function as they age isn't purely physical. There's a huge psychological component. Performance anxiety, for example, can create a vicious cycle. You're worried about not being able to perform, which causes stress, which affects your hormones and blood flow, which makes performance more difficult, which increases the anxiety. Round and round it goes. This is where techniques like mindfulness and meditation can be incredibly helpful. That breathing exercise I taught you, that's actually a form of meditation. You're focusing your attention, calming your mind, and breaking that cycle of anxiety. I also want to address the elephant in the room, and that's medical interventions. You might be wondering, well, what about Viagra or other medications? And look, I'm not anti-medication. In my practice, I prescribe these medications regularly, and they can be very effective for many men. But here's my philosophy. Medication should be part of a comprehensive approach, not the only approach. If you can improve your sexual function through lifestyle changes, better sleep, stress management, and the techniques I've outlined here. That's fantastic. You're addressing the root causes rather than just treating symptoms. However, if you've tried these approaches and you're still struggling, or if there are underlying medical conditions involved, then absolutely, medication might be appropriate. That's a conversation to have with your GP or a urologist. Right, let me give you a quick action plan, something you can start implementing tonight. First, set yourself up for success. Get that alarm clock sorted so you can leave your phone out of the bedroom. Set a reminder on your phone for 2 hours before your usual bedtime. That's when screens go off. Have your evening meal at least 3 hours before bed and keep it relatively light. Start your wind-down routine 90 minutes before sleep. Dim lights, warm shower, maybe some gentle stretching. Then in bed, do your 6 rounds of 4-7-8 breathing. If your mind starts racing with thoughts, don't fight it. Just gently bring your attention back to counting your breaths. In the morning, even if you don't feel dramatically different straight away, take note of how you slept. Did you wake up less during the night? Do you feel more rested? These small improvements are the foundation for bigger changes. And during the day, try to fit in some movement, even just a 20-minute walk at lunchtime. Do your pelvic floor exercises while you're working. These small actions add up. Now, I want to talk about hydration because it's something people often overlook. Proper hydration is crucial for blood flow, and blood flow is crucial for sexual function. But here's the catch. You don't want to be downing a litre of water right before bed, because then you'll be up all night visiting the loo, which disrupts your sleep. So here's what I recommend. Drink plenty of water throughout the day, but taper off in the evening. Stop drinking fluids about 90 minutes before bed, apart from maybe a small sip if you're taking any medications. This way, you're well hydrated, but you're not going to be interrupting that important deep sleep. Let's also talk about alcohol for a moment, because I know a lot of Kiwi blokes enjoy a beer or a wine in the evening, and that's perfectly fine in moderation. But you need to understand that alcohol, while it might help you fall asleep initially, actually disrupts your sleep quality later in the night. It reduces REM sleep. Remember, that's the crucial phase where those regenerative nighttime erections occur. It also suppresses testosterone production and can affect blood flow. I'm not saying you need to become teetotal, but I am saying that if you're serious about improving your sexual health, you might want to consider cutting back on evening drinks, particularly in the couple of hours before bed. Same goes for smoking, if that's relevant to you. Smoking constricts blood vessels, which is literally the opposite of what you want for good erectile function. I know giving up smoking is incredibly difficult, but if you're a smoker and you're experiencing issues in this area, that could well be a contributing factor. There are heaps of resources available to help you quit, and your GP can provide support and advice. Right, let's talk about supplements for a moment, because I know this comes up a lot. People want to know if there's a magic pill or powder they can take. The truth is, if you're eating a reasonably balanced diet, you probably don't need supplements specifically for sexual health. However, there are a few that have some evidence behind them. Zinc, for example, is important for testosterone production. Magnesium can help with sleep quality and muscle relaxation. Vitamin D is crucial for overall hormonal health, and many New Zealanders are actually deficient in vitamin D, especially during winter. But before you start buying supplements, I'd recommend getting some baseline blood tests done through your GP. Find out if you actually have any deficiencies, and then address those specifically. Don't just start taking a bunch of supplements because the internet told you to. Now, I want to circle back to something I mentioned earlier about realistic expectations, because I think this is really important. If you're 70, 80, or older, you need to understand that your body isn't going to function exactly like it did at 30, and that's okay. The goal isn't to turn back the clock completely. The goal is to optimize your function at your current age, to maintain your quality of life, and to stay engaged with your sexuality in whatever way feels right for you. For some blokes, that might mean regular intimate encounters with a partner. For others, it might simply mean maintaining good tissue health and feeling confident in your body. Both are valid and both are worth working towards. I also want to emphasize that sexual health is just one aspect of overall health. When you implement these changes, better sleep, stress management, good nutrition, regular exercise, you're not just improving your sexual function, you're reducing your risk of cardiovascular disease, diabetes, depression, and a whole host of other conditions. You're improving your energy levels, your cognitive function, your mood, your relationships. It's all connected. So even if sexual function is what motivated you to make these changes, the benefits extend far beyond that. Let me share something I've observed over my 15 years in practice. The men who do best, who see the most significant improvements and maintain those improvements long term, are the ones who approach this as a holistic lifestyle change rather than a quick fix. They're the blokes who say, right, I'm going to take my health seriously. I'm going to make these changes and stick with them because I value my quality of life. They're not looking for a magic solution or trying to cut corners. They understand that their body is responding to how they're treating it, and if they treat it better, it will function better. And here's something else that's really important. Don't beat yourself up if you have setbacks or if progress is slower than you'd like. Change is hard, and building new habits takes time. If you miss a day of exercises, or if you fall back into old patterns, that doesn't mean you've failed. It just means you're human. The key is to be kind to yourself and get back on track. Each day is a new opportunity to make choices that support your health and well-being. I also want to encourage you to track your progress in some way. You don't need to keep detailed records or anything like that, but maybe just make a note on your phone or in a diary about how you're feeling each week. Are you sleeping better? Do you have more energy? How's your mood? Sometimes when we're in the middle of making changes, we don't notice the gradual improvements. But when you look back over a month or two and see where you started versus where you are now, it can be really motivating. Before we wrap up, I want to address one more thing that came up in the comments. Someone asked about penis pumps. Look, these devices can be part of a treatment plan for some men, particularly those with more severe erectile dysfunction. They work by creating a vacuum that draws blood into the penis. But they're not a first-line treatment, and they're not something you should just buy off the internet and start using without medical guidance. If you're interested in exploring this option, talk to your doctor or urologist. They can assess whether it's appropriate for your situation and show you how to use it safely. Right, here's what I want you to take away from all this. Your sexual health as you age doesn't have to be a story of inevitable decline. Yes, things change as we get older. That's just reality. But you have more control over this than you might think. The quality of your sleep, how you manage stress, what you eat and when, how much you move your body, whether you do those pelvic floor exercises, All of these factors are within your control. And when you address them consistently, you can see real, meaningful improvements in your sexual function and your overall quality of life. The blue light from screens, eating late at night, poor sleep hygiene, chronic stress, sedentary lifestyle. These are all things that are sabotaging your sexual health without you even realizing it. But now you know. Now you have the information and the tools to make different choices. Starting tonight, you can begin implementing these changes. Put your phone away 2 hours before bed. Do your breathing exercises. Create that wind-down routine. These small steps will compound over time into significant results. And remember, you're not alone in this. Millions of men around the world are dealing with similar issues as they age. It's completely normal and nothing to be ashamed of, but it's also not something you just have to accept and live with. You can take action. You can make changes. You can improve your situation. And the sooner you start, the sooner you'll see results. I've been doing this work for over 15 years now, and I can tell you with absolute confidence that these approaches work. I've seen it time and time again in my practice. Men who commit to these lifestyle changes, who stick with them consistently, see real improvements. Not overnight, but over weeks and months. And those improvements tend to be sustainable because they're built on a foundation of overall health, rather than just treating symptoms. So there you have it, guys. The blueprint is right here. No more waking up without that vitality you once had. No more feeling like your body is letting you down. You've got the tools now. It's time to use them. Start tonight. Put that phone away, do your breathing, get some proper sleep, and begin the journey back to feeling like yourself again. Your body wants to function well. You just need to give it the right conditions to do so. Take control of your health. Take control of your intimate life and reclaim what's rightfully yours. You deserve to feel good in your body at any age, and now you know how to make that happen. Kia kaha, stay strong, and here's to your health.